there's been no closure. There's been no recognition of the harm that was done. There's been no understanding. And it feels to me in many ways like nothing has been learned from this. The treatment she received was abhorrent. Like, as opposed to trying to understand her position or provide informed consent or a framework for that to exist, she was instead bullied and coerced from all angles, from colleagues she'd had for years and people within her union and this kind of thing, right? It's my opinion that upon reading this paperwork that's essentially the experience she had. And then on November 31st, it was her last day of work. And 11 days later, she took her own life.
All right, continuing on from some of the very important interviews from the National Citizens Inquiries hearings that are held in the Greater Vancouver area is a very important one that really points out the shame that it is that the legacy media isn't covering these hearings.
Absolutely, yeah. I think that is an awful shame, right? They're not hearing people's stories and they're not willing to hear any other perspectives. And that's exactly the opposite of what you would expect the news to be, right? They should be reporting, in like an impartial way and sharing everybody's stories, because that is the news, right? Is people's stories and their experiences concerning this.
Exactly. And so this is James Jones from Victoria Island, and his story that he's sharing about his lovely late wife, Sandra Jones, is so important to be heard. So tell us a little bit about who Sandra was and why we are speaking in past tense right now.
Sandra, first and foremost, was my wife, and she was the most beautiful, special, and amazing person I'd ever met in my entire life. And she was a BC Transit worker. She had served them for over 13 years, like loyally, and she worked through the early stages of the pandemic when people didn't really know much about it and didn't know how deadly it was or how it would affect people. She served bravely every day. She went in. She didn't miss any time. She was, like a staple of her community and of her union. When the vaccines rolled out and they started mandating the nurses, I had a concern that they might mandate her. And she felt that BC Transit wouldn't do that kind of thing, that they were an autonomous unit, that they weren't under the health authority. But BC Transit, as a private entity or as a functioning corporation, chose to mandate their workers. And the framework they provided for it was, it's my opinion that there is no person within BC Transit who would have the expertise to be able to offer informed consent. Mm-hmm. And so instead of doing that and working with her and offering informed consent to the employees who had questions concerning the COVID vaccine, they chose to bully and harass, or at least they chose to put it in the hands of people who were unqualified. And in my opinion, those people, their only method they had to have people comply was to essentially bully them and harass them into compliance, which was never going to work with my wife. My wife was a very smart woman, very strong woman, and she required informed consent. Yeah, there wasn't enough information concerning it, right? Concerning treating it like a one-size-fits-all solution was something she wasn't supportive of. So she endeavored to try to achieve informed consent through her workplace. Because they were the ones, from what I understand, BC Transit was not provincially mandated to enforce the vaccine mandates, that they privately chose to engage in the mandates themselves, right, for their employees. She was put off work on November 31st, and it was, at that point in time, I think that was the darkest time for her. I really felt bad, and I didn't know how to comfort her or how to, other than to say that our future would be brighter and that we would work towards something better and that BC Transit was not important in terms of our future. But at the same time, right, I've never held a career for 13 years like that or worked into something where I felt it was really part of my identity, and I was really, so I think it was something I was not entirely capable of understanding. And the days before her death, she actually seemed like she was getting better, like that maybe she had accepted that and she was ready to move forward with me. So I had an enormous amount of hope, right? And then finding her, so I was working night shift. I went to sleep. I stayed up till a little afternoon, till she got home. We hung out for a bit. I went to sleep around 2, maybe 3 p.m., something like that. And then I woke up at 8 p.m. and she still wasn't there. So I sent her a message, a text, and I just went back to sleep, thinking that she would wake me up when she came in the door. Because I trusted her implicitly, I trusted her with everything. And I woke up later, maybe 3 in the morning or 2 in the morning or something, and she still wasn't there. And it was then that I knew something was wrong. So I tried to message her, I tried to reach out, I tried everything I could to sort of like to get a hold of her, and I was unable to do so. And I knew that her family, they live in Gatineau, Quebec. So I knew that it would be maybe 6 a.m. there or something. And so I messaged her brother saying, like, do you guys know where Sandra is? Like, I haven't seen her all night and I'm very worried. And I guess they were worried as well because they did a welfare check. They asked the police to come and check. So the police came. I let them into the apartment just to show them Sandra wasn't there, right? So they would understand, and then they asked if she had a vehicle. I said yes. And I'd gone down and I'd had a peek out there. I'd noticed her car was parked, but I hadn't really thought to anything more. So we went down to the vehicle and we got to the side of it and I noticed she was laying in the back seat. So I started trying to shake the car to try to to rouse her because I thought she was, maybe asleep or whatever thing had happened. And they told me, because I wasn't able to wake her, I knew something was wrong. And they told me to run upstairs, grab the keys so that they could get into the vehicle, right, access it. And I just told them to smash the windows. I said, smash the windows. So they smashed the back window where she was laying, right? So glass exploded inward or what have you. And she didn't move or react, which immediately I started to try to get closer to try to help. But they're like, whoa, step back. And I said, smash the front window, whatever you have to do, just get into the vehicle. They smashed their way into the front window. They were able to open that door, and then from there they used that to open the back door. And then I guess one of them reached forward and grabbed her, and she must have been cold or stiff. They pushed me back and asked me to step back. I leaned up against the wall. In that moment, I lost my mind. Right? And I don't even know if I've recovered to this day or if I ever will, to tell you the honest truth. I'm sorry.
Thank you, sir.
There are days I walk around the house and I talk to her, because we spent so many years together and she is still the central point of my life in many ways, right? It's something that there's been no closure. There's been no recognition of the harm that was done. There's been no understanding. And it feels to me in many ways like nothing has been learned from this. That if things were to go forward in this way, that even the nurses, right, the way they've been treated in these things, and the doctors too, who have been put off from this, it makes me worry about all of these people. And that's the reason why I came out to speak today, was because I don't want anyone else to suffer the way that she suffered or the way that I'm suffering now, right? And anything I can do to prevent that from happening to anyone else is what I would do, right? No matter what the consequences are to me personally, even, or any reprisal or whatever people want to think about me is fine. I just want them to understand the impact of this and how this has affected me and how this clearly affected her, right? And I believe it's fundamentally, this could have been prevented. I believe that if my wife was provided with informed consent, if she had a qualified person to answer the questions and the concerns she had concerning the COVID shot, that some sort of middle ground could have been reached. She was willing to engage in testing, and she was willing to do whatever she had to do, and none of these solutions were good enough. And now that we've come to the other side, and we all understand that the COVID vaccine, the shot, does not prevent infection, it doesn't prevent spread. By being willing to test on a regular basis and even financially to contribute towards that testing, she would have been safer than any of the other workers there. She would have been, because if she tests negative, she's not going to be able to infect other people. So to treat her like she was diseased, to treat her like she was a pariah, instead of offering informed consent, instead of working with her in terms of testing or these other means, is unconscionable to me. There's a bunch of courses that a new BC Transit worker has to go through, and one of them is the anti-bullying and anti-harassment training. And my wife was actually the teacher of that course. So she was the only person certified through BC Transit because it's important that the transit workers, aren't bullying each other. There's not that kind of environment in the workplace, and that they're supportive of one another. But my wife actually received the opposite treatment. She was essentially bullied and coerced and intimidated, at least based on, she left a 40-page log of the experience she had. And in my opinion, upon reading all of that, which I was only available to me posthumously, I didn't know she was writing it. But the treatment she received was abhorrent. As opposed to trying to understand her position or provide informed consent or a framework for that to exist, She was instead bullied and coerced from all angles, from colleagues she'd had for years and people within her union and this kind of thing, right? It's my opinion that upon reading this paperwork that's essentially the experience she had. Every worker who took a job at BC Transit, as long as she had been doing that, had gone through that course where she would train them. And it's a very, very sad irony that she would suffer, such bullying and harassment, and there would be no structure to protect her from that, right? And I just think that I fundamentally feel that BC Transit owed some sort of framework to provide informed consent through the mandates, right? They should have maybe subcontracted that out to professionals who might have been able to provide that form of transparency that my wife required to take the vaccine, essentially. And they just absolutely failed to do that in every way, in my opinion, right? That there was no, it's not credible that anyone within their institution would have had the expertise, right, the medical expertise to be able to answer the questions that my wife had, because a lot of the things at that point in time, they were still portraying the vaccine, the COVID shot, as if it prevented infection and prevented spread. Right, that was what the medical establishment was pushing. That was the idea that politicians, Justin Trudeau was pushing. They were pushing that same idea in the U.S. Joe Biden and the other sort of framework for their government. They were all saying this, and it wasn't until after my wife had passed away that they have now changed their position to it preventing worst case outcomes. Right. So I've always, to this day, I want to know who in that corporation signed off on those mandates and what their training was, what education level they had. And I would also like to know the people who, through the union who supported it, same thing, what would be their education level and what would be, because there was no framework established for informed consent. It was a loose framework where they engaged in bullying and coercion, right? They believed that the vaccine was important. At that point in time, it was still being said by people in the medical establishment and in the government that the COVID vaccine was our way out of the pandemic. And they were portraying it as though if you got the vaccine, you would not be able to get COVID and you would therefore not be able to spread COVID, right? And so my wife died. Well, that was still the sort of prevalent media perspective and news perspective, the prevalent government and medical establishment perspective. My wife also died a couple of weeks before the trucker convoy took place. So it was probably the darkest time in Canada when, in many ways, and definitely the darkest time in my life. The other thing was that I probably failed to mention at the inquiry was that it was also our understanding that she would not qualify for employment insurance either, because the people who were put off due to the mandates would not receive EI for that. So the entire, we call those the social safety nets of society, right? The EI and these are programs we all pay into as workers, we pay into continually. She had paid into that system for over 20 years of her adult life, and she never was able to receive it. And at the one time where she truly needed it, where she truly needed that support, that safety network was removed. It was not there for her, right? And so that's another issue that I think compounded the situation. It's been difficult for me, right? Even the union obstructed her, in my opinion. They obstructed her from being able to redress the grievance or whatever, right? They actually backed the employer when it came to the mandates. So in that sense, she didn't have her union to rely on. She didn't have the employer. She wasn't informed. She wasn't provided with informed consent. There was no framework for them to provide informed consent, right? To me, it's not a credible position that anyone within BC Transit, I'm sure they're great bus drivers and there are people there that can maintain those buses and that they do so competently. I mean, we can see that because the buses are on the road. And there are people, obviously, who can plan routes and work together and plan the hours and the scheduling and these things. But the idea that someone within BC Transit would also have the degree of medical training and understanding in vaccinology and biology, that they would be able to provide her with informed consent is not a credible position to me. I would ask that people try to remain hopeful. Don't lose faith in the medical establishment. And I know it would be easy to do because it was how I felt for quite a while. But through reaching out and through my trying to seek help myself, because this has impacted me more than I probably am able to state. Because I think that's the greatest thing right now for any of us is that we all show support to one another, right? Because there are so many victims of this and people who have suffered trauma, like you said, overdoses and all the other subsidiary factors where they're deaths of despair essentially, right? And so anything we can do to prevent those deaths of despair. These are our fellow Canadians. There are countrymen, there are countrymen, countrywomen, there are brothers and sisters essentially, and we need to unite under that banner. We need to support each other under that banner and recognize that this is what it is to be Canadian, is to support each other and to show love to our fellow citizens and not to alienate people based on any sort of like superficial thing or vaccine status or any of these things. The framework for support and cooperation is something we need to build, because it's something that our establishments, our government and things are failing us in that regard right now. They're failing us. So yeah, be strong, be resilient, and I fundamentally believe we can build a better tomorrow, right?
Well, James Jones, Drea Humphrey with Rebel News, in memory of Sandra Jones.
Thank you.
Did you know that just like the National Citizens Inquiry, Rebel News is also completely independent of government interests, and we rely on the people to be able to bring everybody the other side of the story. So if you appreciate the journalism that we bring you, you can go to rebelnews.com and donate what you can to keep our reports going strong. We appreciate your support.